We have with us today Dr. Vednat Kabra. Dr. Kabra is the head of the Department of Surgical Oncology at the Manipal Hospital, New Delhi. Welcome, Dr. Vedant, and thank you for making time for us today.
Thank you, Khushi, and thank you for taking up this important issue, which will be very useful for the public at large and cancer patients in particular.
Of course, sir.
So here's the first question. So many people with cancer have been wondering if it's safe to get one of the approved COVID-19 vaccines. So should cancer patients take COVID-19 vaccinations?
Okay, so in my opinion, a short answer is yes. But let's see why they should take COVID vaccination. Because in general, cancer patients are more susceptible to get COVID infection. Not only that, they're also more susceptible to have complications of COVID. And once they get infected, they are likely to shed virus for a longer duration of time because they are likely to be immunocompromised. So virus will take some time to go away from the body. So not only are they at risk themselves or at increased risks themselves, they also are at a risk for transmission to other people because they are shedding virus for a longer duration of time. Now, whether it is safe or not, unfortunately, all the large trials excluded cancer patients. So we are not absolutely sure of it. But at the same time, if you see, there is no published data on side effects of vaccine in cancer patients. At the same time, we do not have any reports which say there is increased incidence of side effects in cancer patients. Hence, all the major guidelines and major associations have actually said because of increased susceptibility of cancer patients, it's best that they should get vaccinated at the earliest possible opportunity.
Okay, sir. So there have been some concerns about the use of live viral vaccines in cancer patients. So are those concerns valid, and what vaccine do you think should cancer patients take?
So live viral vaccines cause a problem in patients who are immunocompromised. Now they can be mildly immunocompromised or they can be severely immunocompromised, and they should not be given preferably to any immunocompromised patients. Fortunately, the vaccines available in India are not live viral. There is one adenovirus vector which has been inactivated for division. So it will not divide. It will not cause any problem. So both the vaccines are suitable for cancer patients that are currently available in India. The ones which are in UK, that is Pfizer, Moderna, Johnson & Johnson, again, they are either inactivated viruses or they're killed part of viruses, so they can be taken safely.
Thank you, sir. Sir, so in patients who have recently undergone a surgery for a solid tumor, when can the vaccines be given to them?
Okay. Ideally, if time permits, we should give it around a week before the surgery. We used to give vaccines around 2 weeks before surgery, but for cancer patients, it is okay even to give 1 week before surgery because we usually don't have a lot of time. Once a patient has already undergone surgery and has recovered well, it can be safely given after a week of surgery. If the recovery is a little delayed, then we can delay it till the recovery takes place, because there is a short period after surgery when the immune system is suppressed and giving vaccine may not be as effective as otherwise.
Okay, sir. So also, how do you time vaccination in patients on chemotherapy, since many of them are also immunosuppressed?
Yeah, that's a good question. And I will divide it into different parts because chemotherapy could be very intense and could be very mild. For example, if chemotherapy is being given for hematolymphoid malignancies or blood-related cancers like leukemia, lymphoma, the intensive phase, the beginning phase of chemotherapy is quite intense, and chemotherapy cannot be given during that time. Approximately 3 months duration is needed, especially for those who have undergone bone marrow transplant also. But for other chemotherapies, once the blood counts have recovered, it can be given either between the cycles or, as I said, for surgery, if time permits, even a few days before the chemotherapy cycles begin for a patient. So for a newly diagnosed patient, I would suggest giving it before chemotherapy. For patients already on chemotherapy, once their counts are normal, the white blood cell counts are normal, which indirectly signify that the immune system has recovered. So between the cycles. And for those on very mild maintenance chemotherapy, if their counts are okay, they can take it anytime.
Thank you, sir. Sir, should patients who are on radiotherapy also time their vaccines?
Most of the time, you won't need to time it, but some patients may require to time it for two reasons. One, those patients who are taking chemotherapy concurrently with radiation, then you definitely need to time. And those patients who already have a compromised blood count and radiation is being given to such areas where bone marrow is getting affected and the blood counts may drop further, you again need to time it. For all other patients, you can give it anytime.
Okay, sir. So you already touched on this before, but what are some of the most common side effects of vaccines in general? And are there any specific side effects that cancer patients in particular should watch out for?
The side effects would be like any other vaccine, and mostly they are mild. It would be some soreness at the injection site, which can persist for 2-3 days, mild body ache, or even to some extent fever. And all these side effects would go away within next 2 to 3 days. If they persist beyond that, if there is something more than this, then you need to consult your physician. Very rarely, you may find anaphylactic reaction or what we call as acute allergic reaction to the vaccine. That can be found out just immediately after the vaccination, and that is why there is a half an hour duration of watchful period just after the vaccination, and you cannot go home. If you take cancer patients, I don't think we'll have any specific or very enhanced reaction to the vaccine, because these reaction to vaccine means your immune system is acting. Right, the fever comes, the body ache comes because your immune system has become active. So I don't think there's any increased risk of these side effects, but there is one particular thing which has been seen is lymph nodes which develop in the armpit, which is of more concern for breast cancer patients specifically, because they may be taken as lymph nodes which are enlarged and involved by disease. And there are various ways to confirm that this is actually not disease and the vaccine has caused it.
Sir, if the cancer patients have already contracted the virus, should they take the vaccine, or is it not as important?
Yes, that's again a good question. COVID infection, or for that matter, any infection, is the best way to acquire immunity against that particular bacteria or virus. So COVID infection gives some amount of immunity to the person depending on the severity of the infection. A moderate severity to mild severity, or I would say moderate to severe disease, would probably have a better and a longer lasting immunity. A very mild infection may not develop that kind of immunity, but all these patients would require vaccination as well. Now, the timing of vaccination is usually recommended between 1 to 3 months after the recovery has taken place. And recovery means you have become asymptomatic. So if today somebody has become asymptomatic, a vaccine can be given 4 to 12 weeks after that. In mild cases, I would recommend taking it earlier, because the antibody formation will be very less in those patients. In more severe disease, antibody formation is likely to be good. Also, their immune system may take some time to recover, so vaccine should be delayed so that their immune system has recovered completely. Now, coming to the last part of it, those patients who have received plasma therapy for COVID infection have to delay it for 3 months, because they have already taken antibodies which are circulating in the body. And if you give vaccine, those antibodies will deactivate the antigen component of the vaccine, and it will not be able to generate an immune response that you want. Is that clear?
Yes, sir, that's clear. Thank you for your answer. Now, another question we had for you is, what is your viewpoint on the vaccination of caregivers of cancer patients?
Again, a very important point. Not only cancer patients, but caregivers also should be vaccinated at the earliest possible opportunity, because cancer patients will get it from the caregivers. So vaccination will not prevent infection completely. It may still cause infection, but it will cause a milder infection. So apart from cancer patients, it is always good to give vaccination to the caregivers, whether they're healthcare workers or their family members.
Thank you, sir. So what about cancer survivors, like who are currently not under treatment? So should they be given the vaccine, or?
So
How should they go about it?
yes, a patient who has completed cancer treatment, or many of them actually are on maintenance therapies, hormonal therapies, which are just tablets or some injections, which do not cause immunosuppression. Most of them have the same risk as general population to get COVID infection. And the guidelines for vaccination also remain the same as general population. So they can definitely and safely take it.
Okay, sir. So that brings us to the end of the interview. Thank you so much for taking our time for us today, and we're sure all these
Thank you so much.
Thank you. You're welcome.
inputs will be really helpful to everyone. Thank you so much.